Global engagement informs my work still today. So in the world of research, normally the researchers will look at the literature to find what needs to be researched, or they might find a problem in the clinical setting that needs more evidence to support its solution, or they might sit around a table and say, what should we research? Community engagement is a different approach to research, which involves consulting the very communities we intend to research, even as we're developing the research question. So in my case, because I am studying serious illness and end-of-life care with Hispanic Latino communities, I have recruited a community advisory board consisting of the very people from that very community to advise me, even in developing the research question, and little details along the way about recruitment, and little details along the way about how to execute the study. My community advisory board consists of local community members. One is Colombian American. She is a caregiver to her older adult family members who are facing serious illness and end of life. Another person is originally from Cuba, who had lived in my community for about 15 years and now splits his time between Mexico and the United States. And he was a caregiver to his mother, who received both palliative care and hospice care. And there are two other folks who have, from the Mexican American community, who have also experienced serious illness and end-of-life care with their family members. It's a very humbling experience as a researcher, with all this education and preparation that I've had, to continue learning from the very communities that I'm attempting to serve and that I'm attempting to research and find out information. So even once the study, the data is collected and we have all the information, it would be one thing for me to sit in my office and say, what does this data mean? Or to get together with other researchers from similar walks of life as mine, and for us to try to figure out, what does this data mean? But instead to take it back to the community advisory board and say, these are the results. Let's have a conversation about what this might mean. Let's have a conversation about what it might mean for people in their daily lives. Let's have a conversation about how this data might impact changing the healthcare system to better serve this community. It's a wonderful experience. It's an experience that I look forward to every time I engage with the community advisory board, because I am engaging in global learning, local global learning, every single time I interact with them.